Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
But remember, that will be done with the Kakaki Cancer Awareness, which comes up second and fourth Wednesdays of every month in conjunction with Cornwall Cancer Foundation. And we have this morning founder of Medicine, College of Medicine, University of Nigeria, Nsukka, and University of Nigeria Teaching Hospital, Enugu, Professor Ijoma Okoye. So it's over to you, Doctor.
As they've just been introduced, the Kakaki Cancer Awareness Program with Dr. Denise Ejo in partnership with AIT. Thank you all for joining, and thank you. Medics, Professor Ifeoma Okoye, Prof, we need to hear you, so your mic is not on, and Dr. Ted will be joining me today to have this conversation, and the title of the topic we're going to be talking about is Breaking the Bad News. I want to thank you all for joining us again, and good morning once again to all our I'm going to start this conversation. I want to highlight some things that I've learned. The challenges faced with breaking the bad news is becoming a cause for concern when talking about health. Cancer is not an easy word. And it is assumed that professional physicians find this conversation, which is part of their job or responsibilities. However, it is important to consider that our focus is on breaking the bad news, cancer. In the house, I've got two very distinguished guests of mine whom I appreciate very much, Professor Ifeoma Okoye and Dr.
Yes, yeah, we can. Good morning.
Good morning.
So let me start. Prof, I don't want to waste time, so we're going now. Professor Ifeoma Okoye is and a director of UNN Center for Clinical Trials. I love to hear about clinical trials. Sorry, supposed to be reading your bio. She's also a member of the Cancer Health Fund and founder initiator of a cancer NGO, Breast Without Spots Initiative. She's an editor of two referred to as Pinky Prof. Welcome once again, Prof, to our program on Kakaki.
Thank you very much, Dr. Denise.
And next I've got Dr. Samuel Otene. He is a consultant radiation and clinical oncologist with over 16 years experience. He is the immediate past president of Hospice and Palliative Care National Committee on Cancers. He's a senior lecturer at the Federal University Health Sciences, Otukpo, Benue State, where I served, and also works with ASI Upo, so a dad and a husband, outside of all these jobs. So welcome, Dr. Samuel. I keep calling you Dr. Tennis, so let me just stick to that.
Yeah, exactly.
Good morning. Okay, so as I've started and I've done the brief introduction, I'm going to start my questions. So the first question I've got is, what is breaking the bad news about, and how did it come about? So bad news is the title of a cancer summit that has just held, and I believe we're going to learn about it today. So come on then, what is breaking the bad news?
So, good morning, all. It is indeed often inevitable for healthcare professionals to have to tell a patient and their family exactly how, bad, let's use that word, bad, how maybe you have a heart failure, you've had a stroke, and your deficiencies are irreversible. So it's not only for cancer that a healthcare professional, whatever space or disease area, that you have the duty to break this bad news. There's no healthcare provider that looks forward to it. It's because of inappropriate training, and sometimes even after training, not embracing the training directly, passing on this bad news in an abrupt and very, very insensitive manner, which tends to have a devastating impact on the patients and the emotional state and treatment outcomes. And so we find that this lack of effective communication skills, which are important, the patients, thereby promoting compliance with the treatment plans that you want to put in place to improve the outcome of this patient. The caregiver, the patient, and the doctor. So breaking the bad news may include conveying a life-limiting diagnosis, Mr. Susan, so you have just about 3 months to live. That is how far this disease has gone. And there's not much we can really do to be able to navigate the rest of these 3 months. And for some people who have been given 6 months in such manners, they have lived for 15 years. No one really. However, there is still the duty of the healthcare provider to pass on this information based on what they are seeing clinically through the evaluation facilities that are available to the caregiver. So you have to discuss the constraints or cessation of treatment and acceleration of disease process. So it is often, and they are not very, very palatable situations for anybody. Thank you.
Thank you. That was a very good start to this conversation. Cancer patients, on listening to the bad news nationally and globally, is one that we need to think very carefully. Months, and I'm still here 6.5 years later. So let's but this then I will still say G is God. So yeah, like you rightly pointed. Breaking the bad news, which looked very specifically at this conversation and how we're going to start to strengthen it, strengthen relationships. Which you held. Dr. Tene, can you talk us through that conference, what it was about, and what came out of it?
Well, already giving us an idea of what breaking bad news actually is, and the importance of it. It's key. How well a patient responds to our treatment. I'm speaking specifically for falls on how well even the bad news of that disease was broken to them in the first place. So yes, going specifically to your question, the most important was what we did was to gather healthcare workers who ideally are supposed to have been involved in the process of breaking bad news over the years in their practice. But we all got to agree that we fall short of our patients. Probably are not serving our patients as well as we should in the regard of how we break bad news. It goes to doctor-patient communication or health worker-patient communication, because we fall short. We agreed that our training lacked, we don't have all of the skills we require with regards to breaking bad news. And we own patients, where I really got to listen to the cancer patients and hear what they expect of me, because it made me see my own shortcomings, even as an oncologist, in the process of breaking bad news. So start putting together the framework, the backbone for what would be like a guideline that we can adopt across the country with regards to breaking bad news, which is very important. From different parts of the world, how well are they adapted to our own situation? Because we still have to bring it down to our situation culturally. It has to fit within the cultural context. Somewhere else might not really be acceptable in this part of the world. So we were able to at least begin to acknowledge that there is a need for a guideline, for a framework that we would of getting that together. It's a process, and we plan to hold this event at different times. One is coming up in June, another is coming up in September, another is coming up in workers of healthcare workers into the space, get all of us better oriented, and very importantly, it's about training our trainers. Every single person that was at the program on pass it on. So it's like setting up a workforce, lighting up within the workforce a new kind of passion with regards to breaking bad news. And when eventually we get down to the, to we should be able to have a guideline that will present to the whole country to say, yes, this is how we think every healthcare professional should be able to yes, we were able to achieve a lot in that regard. I don't know if I was able to answer your question that way. Yeah. Then finally, we were also able to agree on cancer support groups, the need to have cancer support groups. It is very clear that support groups that are made up of even patients themselves who would be in a better position to tell other patients what they have been through. Somebody could have been afraid of radiotherapy, afraid of chemotherapy, afraid. I had it. I still have it. But look at me, I'm okay. Hey, I'm okay. So we also agreed on the need for cancer support groups and, so yes, it was a very, very fulfilling seminar. It was a very fulfilling conference indeed.
Okay, so you see, once you have a background, then we now have to start looking at how we're moving forward. Because one of the things I'm very, very and we need to always remember that cancer patients are human, and we feel that before we start. That is where the thing comes from, where you say cancer is not a death sentence. Yes, because by the time you hear the word, it already comes across as a death. You see, once you hear the but I have to laugh about it because it's the only way I cope with this. Okay, so Prof, this is for you now. This is your hands are full with a lot of projects and I think this is one of your babies. I have to admit this is one of your babies as well. So what goals do you intend to achieve in this 2023? Because Dr. Tanya is now telling us you got June, you got this, you got that. But what goals do you intend to focus to? How do you intend to achieve it? What are they, and how is it going to impact or can give you guys the feedback on the progress? Because I think I've come to a point now. You have to measure outcomes, and I want to see measurable outcomes. I'm glad. Over to you, Prof.
Thank you very much for that. I must say that breaking the bad news is not a new entity in our environment. However, though we have, established protocols that have been given by Rabua and McPhee in 1990, they are all, benchmarked on experiences of other populations that don't have the cultural background. So we need to bring, if we're looking at Nigeria-centric that we started on Sunday. And we did quite a lot of that because you have to look into the cultural context, the people's belief, their knowledge. So this is what we were able to come to terms with all the brainstorming and the trainings that went on Sunday, communication skills that to actually listening to the patients and their caregivers and seeing their own perspectives of how they would have preferred that this bad news is. Are quite heavily laundered with a lot of things that they are doing. We recognize that the healthcare providers, basically the doctor and the nurse, initiate the giving of the bad news. Subsequent on giving that, they may not be available to give the level of psycho to be in continuation. So there has to be an integration of a multidisciplinary team that will be involved in continuing to give psychosocial support. The psycho-oncologists, having them available as part of the team, and to create patient support groups but who are also trained. And in order to create this level of manpower, we already have psycho-oncologists. We don't have enough. We agreed on Sunday we don't have enough, so we'll start assist us with the training of the patients and their caregivers to be able to give some level of psycho support. So, we are going to have another training in June. At this time, that training is annexed to another meeting of palliative care team organization. That meeting, we are going to have to train caregivers and the patients themselves. And all those that we trained on Sunday will become the facility. The patients and their caregivers in this meeting, so that we definitely are able to cascade downwards this training and be able to also mentor different hospitals and support teams. That is in June. Now, following in September. In September, we'll train resident doctors in another the caregivers, the patients, and the resident doctors to the table to have better conversations, speak to one another, and agree that we have now understood what is needed. And manpower and capacity across the country will happen in November in Senegal, annexed to the LTIC meeting in Senegal. Now, when I mentioned
Thank you, Doc. I've run out of time now, but I want to thank you very much for sharing that, for sharing your plans going forward. And I wish the project all the success. And thank AIT once again for your continued support in creating cancer awareness, especially at this time where the figures or numbers of people that are dying from cancer are increasing, and yet we're not able to get. Let's hang in there. Let's seek doctors' help. Let's seek advice. Let's look for where we can get things. You can follow us on any of our social media pages at Commode Cancer Foundation and continue with the